Good morning, this is Mandy. In this video, I'm going to go over with you logging into Allscripts and looking at the patient's chart. I'm going to go ahead and I'm going to log into Allscripts. You're always going to be defaulted when you log into Allscripts to the appointment schedule. I'm going to click on today. When you open up Allscripts, there are two tabs in the top left-hand corner. You have your desktop tab, which is the office functions, and then you have the patient tab, which is anything that would involve the patient's actual chart. There are a couple different ways to open a chart in Allscripts. The first way is to double click on the patient's appointment for the day if they have one. When you open up the chart, you can see a couple people already have the chart open. That is okay. You just want to click on New Encounter. And this brings up the patient chart in Allscripts. To close a chart in Allscripts, you want to click on the down arrow. You have your up arrow, which is your pull chart. You have your down arrow, which is your close chart. And you have your green arrow, which allows you to send the chart. I'm going to go ahead and close the chart. And I'm going to go ahead and pull a chart by using the up arrow now versus double clicking on the patient from the schedule. You want to type in your last name, patient's last name. There are various different test patients in Allscripts that you can pull up and you can't hurt them in any way. So I'm going to click over here on my search training patients box and I'm going to search. Let's just go ahead and pull up Carol Test. So we want to double click on her. It brings up this, which is what is called the face sheet. On the face sheet, you have the past problem list and the past medical history. You have the past surgical history. You have the allergies. Now the allergies will also always appear in what is called the patient banner. Notice I'm closing up the patient banner and now I'm opening the patient banner. The allergies will always appear here in red. In the patient banner, once we start taking pictures, you'll see the patient's picture here. Now mind you, this is a test patient, but in a regular patient's chart, you would see basic information about that patient, such as their name, date of birth, age, their insurance. This no web account here, if they had set up a patient portal, it would say web account. Obviously, so this patient does not have a web account. You can also see their next appointment here over in their patient banner. So you have your social history, you have your health maintenance, and then you have other past history. Other past history would be if the patient came in one day with pain, you documented that in your note. They came in though 3 months later and their pain was gone. What you want to do is you want to clean up the face sheet. You want to click on pain, you want to right click, and you want to demote it. When you demote it, it brings it to the other past history. So here is my pain. It is no longer in the patient's active problem list. If the patient comes in 3 months later though and is having pain again, you can go down to your other past history. You can right click on pain, you can promote it, and it brings it back into the active patient problem list. There is a cogwheel here. You can always change your cogwheel. I recommend having it show all and sort from newest to oldest, but you do have other options that If maybe you only want to see what is active, you can have it on active. Maybe you want it to sort it alphabetically, you can do that as well. The second column of the face sheet is your encounters section. So maybe you have a patient that comes in to follow up today, but they tell you that they were just seen in walking care or maybe the surgical office 3 days ago. Here are your prior Warren Medical Group office visits. If I want to see the last surgery encounter visit, I can double click and it'll pull that visit for me. I'm going to go ahead and X out of that. You can also see in this section patient messages. You can see scanned documents and attached documents. An example of an attached document would be a work or school excuse. You could double click and that will bring up the work or school excuse for you to view. The next section here in the face sheet is your medication section. I recommend having your cogwheel for the medication section set to all medications and newest to oldest. Maybe you only want to see current. That is okay, but keep in mind if the nurses are trying to get a prior authorization on a medication, they're going to want to see all medications. So maybe this patient is on omeprazole, but they have tried Zantac and Pepcid in the past. That would be under previous medications. Last section down here is your order section. I recommend having your cogwheel set to all orders by group and newest to oldest. So if you have a patient down here that had a chest x-ray and you want to see the results of that chest x-ray, all you have to do is double click, and if this were a live patient, it would show you the results of the chest x-ray. Over here you have some icons. This icon, if there is a number in here, this indicates that there is a result notification in Carol's chart that has not been reviewed by the provider. This next envelope is a patient message. This patient message has not been addressed by a provider or saved to the chart yet. And then you have your RX icon. If there is a patient refill request in the chart that has not been addressed, you will see a number in this box. And this here is your patient reminders. So maybe a patient is past due for a colonoscopy. You could go ahead and set up a reminder. That reminder would pop up to everyone when they open the chart. And you'll also notice your icons match. So this is a notification of a result. If you come over here, you have the same icon. Your envelope here, you have your envelope over here also in your message box. You have your RX and you have your refill request. And then you have your reminder and you have your reminder here. In order to set up a patient reminder, you want to click on reminders and click on the plus. This allows you to set up your reminder. Once you're finished, you want to click Save to Chart.